Have you ever stopped to think about how today's small habits can define your quality of life 10, 20, or 30 years from now? If you've already celebrated your 50th birthday, you may have noticed that simple activities, like tying your shoelaces or squatting to pick something up off the floor, now require more effort and sometimes even cause discomfort. The reason lies in the gradual loss of strength, reduced joint mobility, and weakening of the core, the group of muscles that surrounds the abdominal, lumbar, and pelvic region, acting as a foundation for all movements. The less we use these muscles, the more they atrophy, leading to chronic pain, a hunched posture, and a greater risk of falls. That's precisely why many health and physical performance professionals emphasize the importance of isometric exercises, static movements that, even without lifting heavy weights, create continuous tension in muscle groups, triggering deep adaptations. In this text, we'll explore the horse stance in detail, an exercise forgotten by many but capable of completely changing the way you age. I'll address not only proper execution, but also the physiological mechanisms involved, gradual adaptations, possible variations, weekly progressions, and the most common mistakes that can compromise your results. By the end, you'll have a complete guide to incorporate this exercise into your routine and ensure your body stays strong, stable, and agile for many years. What is the horse stance? The horse stance is a classic isometric exercise in martial arts, but it can be perfectly adapted for those seeking not only self-defense but also longevity, mobility, and overall strengthening. It involves holding the body in a position similar to that of a mounted rider, feet apart, thighs parallel to the ground, and spine upright. Although it may seem simple, its effectiveness lies in the continuous tension placed on the primary muscles responsible for body support: quadriceps, hamstrings, glutes, adductors, calves, spinal erectors, and the entire core region. When performed correctly, this exercise acts as a bridge between strength and mobility, as it simultaneously strengthens tendons and ligaments around the knees and hips, improves the flexibility of adductors and hips, and reinforces the neuromuscular connection responsible for balance. Detailed benefits. The horse stance is not just a simple endurance exercise. It activates entire muscle chains and creates physiological adaptations that extend far beyond the moment you stop holding the position. Below, I detail the main benefits associated with regular practice, explaining the biochemical and biomechanical foundations. 1. Isometric muscle hypertrophy and endurance. During isometric contraction, muscle fibers remain under continuous tension without changing their length. This causes micro lesions in specific areas, triggering repair and protein synthesis processes that, over time, lead to increased hypertrophy and endurance. Additionally, maintaining constant tension stimulates the metabolic efficiency of the muscles, improving their ability to absorb oxygen and nutrients. Thus, even people who cannot lift heavy weights can, through the horse stance, develop significant strengthening of the quadriceps, hamstrings, and glutes. 2. Joint protection and integrity of tendons and ligaments. In dynamic exercises such as running or loaded squats, the joints endure impacts and concentric and eccentric movements that can cause accumulated microtraumas. In the horse stance, the knee joint is positioned at approximately a 90-degree angle, but without repetitive movement, allowing tendons and ligaments to be trained under constant tension, yet without impact. This reinforces the integrity of the periarticular structures and reduces joint instability, minimizing the risk of injuries such as early onset osteoarthritis. 3. Increased flexibility and joint range of motion. When holding the position for extended periods, there is a gradual and passive stretching of the inner thigh region, adductors, promoting greater hip opening. This effect is reflected in the ease of performing other activities such as deep squats, trunk rotations, or lateral leg lifts, as well as improving the mobility needed to reach objects on high shelves or simply perform a deep squat without pain. 4. Postural correction and spinal alignment. The horse stance requires you to maintain a neutral spine, with your shoulders slightly pulled back and your chest open. This combination of factors teaches the central nervous system a new pattern of upright posture, which tends to transfer into daily habits such as sitting in a chair, walking, or even standing and having a conversation. As a result, the risk of kyphosis, hunched posture, and hyperlordosis, excessive lower back curvature, is significantly reduced. 5. Core stimulation and lower back protection. To hold the position without letting the hips drop, it is essential to contract the transverse abdominis, rectus abdominis, obliques, and spinal erectors. This strengthening, achieved through isometric contractions, protects the lumbar region from compensations that cause chronic pain. Additionally, a strong core improves biomechanics in everyday tasks, such as lifting grocery bags safely. 6. Improve balance and proprioception. Keeping the weight evenly distributed on both legs, with the torso stable, requires advanced sensory coordination. Proprioception, your sense of body position in space, becomes sharper, making your body more efficient at adjusting its center of gravity during unexpected movements, such as tripping or stepping on uneven ground. 7. Mental endurance and stress control. When your legs start to tremble and the burning sensation sets in, your instinct is to rise. Persisting in the posture teaches you to breathe consciously, training your autonomic nervous system to respond better to stress and temporary discomfort, generating a mental resilience effect that goes beyond workouts and positively influences your ability to handle everyday challenges. Step-by-step execution. Now that we understand the principles and benefits, let's detail each step so you can perform the horse stance correctly, avoiding mistakes that could compromise both your results and your safety. 1. Initial preparation. Choose a flat, obstacle-free space. Wear stable shoes, preferably sneakers with a firm sole to prevent slipping. If you prefer, you can practice barefoot as long as the surface is non-slip and free of sharp objects. Wear comfortable clothing that allows full range of motion in the hips and shoulders. 2. Base positioning. A. Spread your feet. Start with your feet slightly wider than hip width, then progress to placing them about 1.5 times that width to maximize adductor engagement. B. Slightly turn your feet outward. Gently rotate your toes outward at an angle of 10 to 20 degrees on each side. This helps better accommodate the hips and distribute the load evenly. C. Knee alignment. Push your knees outward, but don't overdo it. Ideally, they should stay aligned with the path of your toes, avoiding inward collapse. Dynamic valgus, which can place stress on the medial collateral ligament. 3. Controlled descent. A. Slowly flex your hips as if sitting on an invisible bench. Lower yourself until your thighs are parallel to the ground, or as close to that as your mobility currently allows. B. Maintain a neutral spine. Imagine a vertical line passing through your ear, shoulder, hip, knee, and ankle. Even while squatting, aim to maintain this line so that your torso doesn't lean too far forward or your lower back arch excessively. C. Arm and torso positioning. Keep your chest open, shoulder blades retracted, shoulders back, and gaze straight ahead. This helps maintain an upright posture and avoids unnecessary tension in the cervical region. Maintaining the posture. A. Contract your abdomen. Activate the transverse abdominis as if pulling your navel toward your spine. This stabilizes the lumbar region. B. Contract your glutes. By squeezing your glutes, you further protect the lower back and ensure your hips don't sag. C. Conscious breathing. Inhale through your nose as you get into position and exhale through your mouth or nose in a steady rhythm while holding the stance. Your breathing should be calm, avoiding breath holding, Valsalva maneuver, which can raise intra-abdominal pressure undesirably. D. Focus your gaze and mind. Fix your gaze on a steady point in front of you to help with balance. Mentally, connect to each part of your body: ankles, knees, hips, abdomen, spine, chest, shoulders, and head to ensure each segment is properly aligned. Duration and progression. A. Beginners. Hold the posture for 30 seconds. If holding exactly 90 degrees is uncomfortable, go down as far as you can without pain, for example, to 100 degrees or higher, and hold that position. B. Intermediate. When 30 seconds becomes easy, increase to 1 minute and then to 2 minutes. C. Advanced. Work up to 3 minutes or more, adding variations like raised arms or slight pulses to intensify. Sex gentle release. When finished, slightly bend the knees. Return to the starting position and slowly stretch the hip and adductor muscles to release accumulated tension. Perform slow hip rotations, knee drop stretches, or butterfly stretches to relax the inner thigh muscles and avoid delayed discomfort. Common mistakes and corrections. Incorrect execution of the horse stance can limit its benefits and even cause discomfort. Below are the most frequent mistakes and how to fix them. 1. Knees caving inward. If your knees tend to move toward each other, focus on pushing them outward, as if trying to open your thighs sideways. Slightly turn your feet outward to assist this movement. 2. Curved spine. Many people lean the torso too far forward or excessively arch the lower back. To avoid this, imagine a string pulling the top of your head toward the ceiling. Keep your neck neutral neutral and engage your core and glutes to stabilize the spine. 3. Looking down. Keeping your gaze down compromises your balance and tends to make the torso lean forward. Always look at a fixed point in front of you at eye level. 4. Irregular breathing. Holding your breath or breathing heavily reduces endurance and can raise blood pressure. Focus on deep breathing. Inhale for 2 seconds, exhale for 2 seconds, maintaining a steady rhythm. 5. Uneven feet. If one foot is positioned higher than the other, for example, a slightly lifted heel, the pressure on your hips and knees becomes unbalanced. Make sure both feet are firmly grounded, with weight evenly distributed. Variations and progressions for each level. The great advantage of the horse stance is its versatility. It can be adapted for beginners, intermediates, and advanced practitioners, ensuring continuous progression and avoiding plateaus. Below are variations that can be introduced progressively. 1. Basic stance with support. For those just starting or who have mobility limitations, use a chair, wall, or stable surface to support your hands during the descent phase. This allows you to focus solely on leg positioning and trunk alignment, reducing the risk of imbalance and placing excessive load on the knees. 2. Unsupported stance. The goal is to achieve the classic form without any support. At this stage, you maintain a wide base, knees aligned, and torso upright without needing assistance to hold the position. 3. Adding weight to the chest. Hold a light dumbbell, 5 to 10 kilograms, in front of your chest with elbows bent. This added load increases the tension on the lower muscles, promoting greater adaptations without changing the basic posture. Remember to keep the weight balanced and stable to avoid compromising trunk alignment. 4. Horse stance with raised arms. Extend your arms overhead, with palms facing each other or forward. This movement raises the center of gravity, demanding even more from the core and stabilizing muscles. It's important to keep the shoulders away from the ears, avoiding tension in the neck region. 5. Isometric pulses. In the lowest position, perform small up and down micro movements, about 5 to 10 centimeters, for a period of 30 seconds without ever fully relaxing. This creates even greater tension in the quadriceps and adductors, intensifying muscle engagement. 6. Brief lateral shift. Maintaining the classic horse stance. Make a slight sliding movement to the right, then return to center, then slide to the left. Each lateral shift should be controlled, as if you were sliding your feet on the floor without changing the height of your thighs. This variation develops greater spatial awareness and adaptively strengthens the adductor and abductor muscles. 7. Horse stance with isometric trunk rotation. Hold a light dumbbell in front of your chest, or use a resistance band anchored to the side. While maintaining the stance, rotate your torso to the right, then to the left, keeping your legs in position while performing the core rotation movement. This adds spinal rotation stimulus, strengthening the obliques and transverse abdominis. Suggested weekly schedule. To achieve consistent progress without overloading the body, it's essential to properly periodize your practice, respecting periods of effort and recovery. Below is a recommended schedule for beginners, intermediates, and advanced practitioners. 1. Beginners. First 4 weeks. Frequency, 3 days per week, e.g. Monday, Wednesday, and Friday. Sets, 3 sets of the basic stance with support. Duration, 30 seconds per set. Rest between sets, 60 seconds. Progression. Each week, add 5 to 10 seconds to the duration of each set or gradually reduce your reliance on the support, hand assistance. 2. Intermediate. Weeks 5 to 8. Frequency, 4 days per week, Monday, Tuesday, Thursday, and Friday. Sets, 3 sets of the unsupported stance. Duration, 1 minute per set. Rest between sets, 45 seconds. Progression, every 2 training days, add or increase variations. First week, unsupported stance. Second week, stance with light dumbbell held at the chest. Third week, stance with arms raised. Fourth week, introduce 15 seconds of pulses after 45 seconds static. 3. Advanced, week 9 onward. Frequency, 5 days per week, Monday to Friday. Sets, 3 sets of the advanced stance. Pulses or lateral shifts. Duration, 2 minutes per set using load variations, 5 to 10 kilogram dumbbell, or arms raised. Rest between sets, 30 to 45 seconds. Progression, each week, increase the duration by 15 to 30 seconds or add new variations. Horse stance with isometric rotation, or stance with alternating knee drops for floor touches while keeping thighs at target height. Technique refinement over time. As the weeks go by, your body adapts to the isometric load, and the goal becomes maintaining the same quality of form while aiming for longer time under tension and greater range of motion. To monitor your progress, you can use the following criteria: total time under tension. Add up all the seconds you've spent in the horse stance across sets and days. A beginner might start with 90 total seconds, 3 sets x 30 seconds, while an advanced individual can accumulate 360 seconds, 3 sets x 360 seconds, 120 seconds. Perceived exertion level. Evaluate how challenging the exercise feels on a scale from 1 to 10. Each week, try to keep the same effort level while increasing time or difficulty. Joint range. Use a ruler or measuring tape to check the distance from the floor to the inner thighs when you reach the lowest position. Over time, this distance should decrease until the thighs are parallel or nearly parallel to the ground. Stability. During execution, try closing your eyes for a few seconds, 2 to 3. If you can hold the position without significant sway, your balance and proprioception are improving. Additional precautions and contraindications. Despite its high beneficial potential, the horse stance requires specific precautions, especially for individuals with a history of compromised joints or pre-existing medical conditions. Consider the following guidelines. 1 prior evaluation if you have a history of knee problems, such as chondromalacia, injured ligaments, or damaged meniscus. Consult a physical therapist or orthopedist before adding the horse stance to your routine. 2 range adjustments. In cases of mild osteoarthritis or severe hip stiffness, maintain a higher stance. Thighs at 110 to 120 degrees instead of 90 degrees, until mobility improves without pain. 3 use of wedges or heel elevation. Those with limited ankle mobility can place a small wedge, 2 to 5 centimeters under the heels to allow greater comfort and knee alignment. 4. Pain monitoring. During the exercise, it's normal to feel discomfort or muscle burn. However, sharp pain, stabbing sensations, or internal pressure in the knee or hip means you should stop immediately and seek professional evaluation if it persists. 5. Breathing and circulation. In cases of uncontrolled high blood pressure, shallow breathing or breath holding during the stance can raise blood pressure further. Maintain a calm breathing pattern, and if you notice symptoms such as dizziness or blurred vision, stop immediately. 6. Warm-up and post-stretching. Before performing the horse stance, do a short warm-up of 5 to 10 minutes, including joint movements for the hips, knees, and ankles. Hip circles, shallow squats, ankle rotations. After your session, stretch the inner thighs isometrically, butterfly stretch, and perform a few reps of hip stretching, floor-modified pigeon pose, to reduce lactic acid buildup and improve local circulation. Conclusion. The horse stance represents far more than a simple static squat exercise. It is a pillar for anyone who wants to age with quality, maintaining strength, stability, mobility, and vitality. By isometrically training the leg muscles and core and strengthening the tendons and ligaments around the knees and hips, you build a solid foundation that supports all daily activities, from climbing stairs to playing with your grandchildren without pain. Furthermore, the mental aspect of the practice, enduring the burn, controlling your breath, and staying focused even when your legs shake, builds psychological resilience that carries over to other areas of life, enabling you to face daily challenges with greater calm. Finally, remember that any progress requires persistence and patience. Start with short durations, basic supported form, gradually evolve as your body adapts, and never sacrifice proper form for longer time or heavier load. With this complete guide, you're ready to begin your journey with the horse stance and reap all the benefits it offers.